coronavirus has been declared as a pandemic, and and these are tough times. We have to agree, but the thing is that what exactly are the nitty-gritties associated with the coronavirus, and how can we keep it safe? And how much is India prepared to tackle the coronavirus menace? And also, how much is the Northeast ready for any eventuality of sort if the situation demands? To know all of this, I'm being joined by Dr. Bhaba Jyoti Bora, who is a member of the World Health Organization. He has been a part of the team of the World Health Organization that went to Africa when the Ebola virus outbreak happened. And today he's also associated with the entire structure that is overseeing the entire coronavirus situation in Assam. So we're joined by Dr. Bhaba Jyoti Bora. Let's get to know some facts from him today. Sir, thank you so much for joining us, sir.
Thank you.
First of all, sir, I would like to begin this conversation by asking what exactly is the coronavirus and how would you describe it in a layman's term to the people, because a lot of rumors have been doing rounds regarding this virus. What are the facts, and basically how would you explain this entire scenario to the people? We want to know.
This coronavirus is not a new virus. It is a simple flu virus. Just it has changed its character. That by changing the character, it got some this that infectivity is very high. That's why this so much people this are infected, and more or less that main problem we are now facing. It engulfed this most of the countries in all the this all over the world. That is the main problem we are now facing.
So, so how does this virus spread, sir? Because now the thing is that obviously people are seen wearing masks. There's a lot of emphasis on maintaining personal hygiene. There has been a demand for for hand sanitizers and items like that. That it has led to a shortage in the market. So, how what exactly as someone from the medical line can you talk about in this regard?
To see that this virus transmission, as presently this now we came to know that it is through droplet infection. Droplet infection means ultimately, if we touch some this hard surfaces where this virus is there, that will come into our body. So if we block that chain, that means that that through hand to our this body. If we can block that chain, it is possible to get rid of this infection from that virus. But one thing that this mask is not entirely this required to wear as a normal habit. Yes, it is required for some these medical personnel who are treating the patients, who are working in the environment where it is truly required, but not for public. It is not at all required, because only hand washing, hand hygiene. That is the only way to get rid of this virus.
So, how much would you think that is the preparedness level right now in India to tackle the virus? And can you throw some light on what kind of precautionary measures have been taken in Assam in particular, since you are also associated with it?
No, in that case, see that daily updates, daily advisory. Because day and night, this government of India is working on that. This as it is a new virus, and considering our health infrastructure, they are working on that. And daily advisory is giving, and in fact, this in Assam, this chief secretary is involved to tackle the situation. So in that case, health department is fully prepared. But one good thing is that till today in Assam, we don't have a single virus, the single case detected till now. But I don't want to say that yes, we must be prepared for that, and virus may come. Virus may come, but we must be prepared to tackle the situation. And main problem is that this public panic.
Okay.
Unnecessary, we are giving panic to the public. Public is so panic for corona, and that is because of this uh, social media network and everything. And I will tell you that what is rule of public in this situation.
Okay, but we want to also, since you have mentioned about the situation in Assam, how you're tackling it. Recently, we saw this case of this American tourist who was detected in Bhutan, and that fellow had gone to several places in Assam. We want to know how has the health department, and especially you people and your team and all, how have you gone about examining each and every place where the tourist has gone, and how has been the outcome so far?
No, see, regarding this case detected in Bhutan, who has this extensive travel history in Assam, our this government of Assam health department has tracked very properly, and ultimately they have tested that this close contacts all came as negative. So it seems that from that particular this positive case, that virus has not been transmitted to other people.
This was done in all the multiple locations where you went.
Yes, all the multiple locations. Because recently I have visited this Vishwanath Ghat, where that particular tourist has visited. No one is this having the symptoms. Already 14 days already over. So in that, from that scenario, I came to know that from that particular tourist, that virus has not been transmitted to others. But health department is very extensively they are prepared to tackle the situation.
How far do you think are we prepared at the ground level? And also, I want to bring up to you the first case of death that happened in India a couple of days ago. That man in Karnataka who died. Many are calling it a case of lackadaisical attitude from the medical staff who attended him, in spite of the fact that he was a suspected coronavirus case at that time. What do you have to say on that? And how much are we really prepared at the ground level for any eventuality of this sort?
No, that is the ample example, particularly that Karnataka case. What we have seen, that patient is discharged against medical advice. So that is the public. This this should this aware about this. Public should be responsible for this, and that should be the public should be concerned for that. That why a case should be treated properly, and he is deprived of that particular this because of some this of his family problem or whatever it may be. But public should be aware about that, and that is the public responsibility, because of that ultimately that in this around of that particular family or that this family, that he may transmit the viruses. So that's why this public awareness on particular this case, I have not satisfied.
Uh, Considering the fact that Assam is closer to Southeast Asia and also closer to China for that matter, initially there was a fear that since because of its geographical proximity to this region, Assam and the Northeast may become easy target for the spread of this virus. Thankfully, things have not turned out that way. But do you think such a factor can actually is actually possible because of the geographical proximity?
When we see that this entire global map, that in Assam we are very close to China, if you see, and in fact this sharing some porous borders where these people can travel for this some trading or this that is there, that is not officially declared, but yes, that may be one the sources that they can carry the virus to this this part of this India, and that's why one point and this I want to mention you that this Bhairav Kunda, where this Bhutan border, even same type of screening as this airport, they are doing the screening of this peoples who are coming from Bhutan to India and in India to Bhutan, they are doing that. So if we have this type of this uh, preparedness, I don't think that this virus may create any problem with us.
Okay, there are also reports that this virus may not survive the onslaught of higher temperature, or like some people are saying that by the time winter comes and there are higher temperatures, the effect of this virus is going to slow down. How much is truth in that?
Let me see. We have to think that what will be the outcome, how long this particular this corona, this will occur. Yes, particularly this virus is a very mild type of virus. Mortality is very low, and it is a heat sensitive virus. So, depending on this environment, that particularly hot climate, this virus cannot be cannot grow in just like in Wuhan. Wuhan, this city, the today's temperature is say 9 to 13 degree, but now here this we are having the 23 to 24 degree. So and next this coming this summer it will be go rise up to the 30 34 degree. I don't think that this virus can stand in that high temperature, and because this is a very mild virus.
We can say that is there any particular temperature beyond which the virus cannot survive?
Usually, what this presently we came to know that this 28 to the maximum 30 degree this centigrade, this virus cannot stand. So, considering the this climatic condition, so we expect that this particularly this virus will subside. Uh, and one thing is that body temperature is 37 degree, right? And this, if I say that 30 degree, this virus cannot stand, right? So how this virus can stand in the body? So that is the this scientific term is called in vitro and in vivo. That when virus enters in the body, it adapt in that environment. So ultimately, that virus can stand in the body, and it can this circulate and in the body. So in that case, I don't think that this will happen in future for this particular virus, because this is not only that this coronavirus. What we have seen that last 20 years, 22 or 23 new viruses has appeared all over world. So what we have seen that all the viruses ultimately subsides. And one of the this biggest problem, as you this consider that this Ebola. Ebola is more dangerous than this particular virus.
We can say that even though coronavirus has had a higher reach than the Ebola, we're still in a better position to tackle the coronavirus. Am I right?
Yes, very. It is very easy to tackle this coronavirus because number one, mortality is very less, and by the time, yes, it is a new virus. Initially, these people they do not know what to do, how to this handle. Now we came to know what is that this mainly this transmission chain, how to block that virus. So if we maintain that, it is very easy to tackle.
The message is clear that yes, personal hygiene has to be maintained, and obviously rumors are not to be spread. Am I right?
Yes, see one thing, say hand washing, personal hygiene. Why only for corona? So many diseases we can avert this by simply this adopting this hand washing. So this should be this practice of the common people, and common people should not worry, should not panic for this particular this corona. They should maintain their hand hygiene. Simple example: if you go to one hotel, did you find that this hand washing equipments in there this before entering the hotel? So we should for doing that, why this law is required? That is this what is called public should this
These things
awareness.
should be, should happen by themselves.
Public awareness and this the people's awareness. They should understand that already people understand that the hand washing is the this only tool to get rid of these viruses. But that should be practiced and not to be panic. Unnecessary, this public is panic, uh, and I don't think that this virus is not that dangerous virus, and we have faced so many dangerous viruses before. Only request the public should adopt that hand washing, hand hygiene practice, not only for this corona, for so many diseases.
For daily life, it should
Exactly,
be a,
exactly. That should be this part and parcel of their life.
the message is loud and clear. Maintain your personal hygiene. Don't give in to rumors, and the coronavirus outbreak can be contained. And it's just a matter of time before it slowly subsides. There's nothing to worry. This is Joydeep Hazarika with cameraman Debojit Boro for Northeast Live.